This quarter is called Pulse, the World of Medicine. The host here is a popular host of GTV, and many of you love him and his feature called Anoke Rang. Today we have borrowed him to host this medical segment where he will interview a well-known allergist and immunologist by the name of Dr. Adhuna Mathuria. Spring is here, and many of us, including myself, just can't beat the allergy season. Many of us suffer from chronic allergies, and many of us from seasonal allergies. Let's hear Dr. Mathuria's viewpoint on allergies. Stay tuned.
Hello, I'm Dr. Krishan Chhabra and welcome to the world of medicine. Well, the spring has sprung and we can see beautiful multicolored flowers, blooming trees and lush gardens. But with that, for some of us, it also brings sneezing, runny nose, watery eyes and all those dreadful symptoms of allergies. What can we do? Well, to answer this question and much more, I have a guest in the studio today, Dr. Adhuna Mathuria, who is an allergist and immunologist. Welcome, Dr. Mathuria.
Thank you, Dr. Chhabra. Thanks for having me.
Sure. Now, Dr. Mathuria, before we get into the what, why, and how of allergies, could you tell our viewers a little bit about your about your background, education, and the training?
Sure. I grew up in the area in Northern Virginia, went to Langley High School. I did my residency training at Georgetown Medical Center, and then I continued to do my allergy immunology fellowship at Johns Hopkins Hospital.
Oh, that sounds impressive. You mentioned the word immunology. What exactly does it mean?
Immunology is a really interesting part of our field. It's a very broad area, and it's specifically the study of the immune system and how it fights off diseases or infections.
I see. Okay, so how did you get interested in this field?
Well, that's another great question. I've had a love for allergies, probably because I grew up with allergies and received great benefit from allergy shots.
I see.
But I think my interest was really sparked in medical school when I was in an immunology class, and I was really interested in the science of allergies and why the reactions occur. And even to this day, though we've come a long way in our allergy field, we still don't understand what exactly makes one person sneeze, one person wheeze, and one person have itchy eyes to the same type of allergy.
Right. Okay. Now, can you talk about different types of allergies and their symptoms?
Sure. So we have several types of allergies. One is food allergies. When a person ingests a particular food protein like peanut or cow's milk, they can have an allergic reaction. Those symptoms can be an itchy rash, hives, breathing problems. Another type of allergy is drug allergy. Same type of symptoms to something that is any kind of medication actually can cause a drug allergy. And you can have a diffuse rash, you can have breathing issues or swelling. One of the most common type of allergies is seasonal allergies.
Yes.
And this can occur in the spring, summer, or fall to different pollens like tree pollen, grass, or ragweed.
Right.
We can also have perennial allergies. And this is an allergy to year-round allergens like dust mite or mold, cat or dog.
That's right. That's right. Now, what is the cause of these allergies?
So that's a fascinating question. The allergen will enter a person's body either through ingestion or inhalation, and then it binds to an allergy antibody called IgE.
IgE,
Yes, and this IgE antibody is sitting on a mast cell, and it then triggers a histamine release. And histamine is that annoying molecule that is responsible for all the symptoms that you see, the watery eyes, a runny nose, or even the coughing or wheezing.
That's the term I've heard a lot, histamine and antihistamines and all those things.
Yes.
Now, we know that certain types of allergies, like, the bee sting, can be life-threatening, right?
Yes.
So are there any others too like that?
Yes, so venom allergies, specifically to stinging insects like bees, can cause anaphylactic shock. And what that is a more systemic and serious reaction that can cause serious side effects. It can cause loss of consciousness, low blood pressure, swelling, and other types of allergies that can cause this are food allergies, like something like peanut or even tree nuts.
Okay, I see. So what are the tests you have for these allergies?
We've come a long way in our testing. It's still not perfect, but the two main types of testing are skin prick testing and then blood tests.
Okay.
So for the skin testing, the way we do it is you have a small amount of a purified extract. You place a drop on a patient's skin, and then you slightly prick it. You wait about 15 to 20 minutes and you look for a reaction. And that reaction usually consists of a mosquito bite-like reaction. And you can measure it. And that tells you exactly what the person's allergic to and how severe the reaction might be.
I see. I actually do remember a long time back they give you all these, the pricks, they go all over.
Yeah.
But is it likely that you could use the blood test rather than the pricks?
The blood test is definitely a possibility, and there are newer forms. The blood tests are getting better and more sensitive and predictive. And the way they do that is that they measure your specific allergy antibody to an allergen. And so you can actually determine a level to see what you're allergic to. So to something specific like oak tree pollen or egg white allergy, for example, you can determine the amount of allergy antibody that you have in the system.
I see. But in terms of the breadth, you can do all those kinds which you can do with the prick test, and also is that the same in terms of the accuracy?
So that's a really great question, and this is where science hasn't quite caught up. It's a little bit of an art. But yes, the blood tests have a huge variety of available tests. And you actually need very little amounts of blood to test a lot of different things. They have lots of panels now, so you can do a seasonal allergy panel, a perennial allergy panel. And the accuracy is a little bit tricky because on the skin tests, you can have false positives, but you usually don't have false negatives, which means if it's negative, it truly is negative.
I see. Okay.
On the blood test, it's the exact opposite. So you can have a false negative, which means it might not actually be completely negative. But physicians are usually, especially allergists, usually well trained to consider this when interpreting the tests. So we can still give the person a pretty accurate representation of what they might be allergic to.
Right. So let's now talk about the treatments. Once we know that you have allergies, the symptoms, so what are the treatments for that?
So the mainstay of our treatments are oral antihistamines. And these actually block the histamine from producing all of the side effects that are unwanted. Some of the newer generation antihistamines like Claritin, Allegra, Zyrtec, they're second generation, so they're a little bit less sedating. But all of our antihistamines still have the tendency to cross the blood-brain barrier, and they can be a little bit sedating.
Now I know that some of them, make you drowsy.
Right.
What does it mean? And are there any pros and cons for that, or?
That's a little bit more tricky, and the newer antihistamines, they do help a little bit, but we run into this problem all the time. And I think that's sort of where we've changed our direction in terms of treatment to be more topical. So for example, for the nose, we have a nose spray now. You can use a nasal antihistamine or a nasal steroid. For the eyes, we have an eye antihistamine eye drop that you can use. And for the lungs, you have specific steroid inhalers that will also help your symptoms.
I see. So it means, depending upon the type, we can pick the kind of the treatment.
Exactly.
Now, are these like long term, or is it like whatever treatments you have, or the short term, or what?
So it is. They are great short term medications. The nasal steroids can help a little bit more long term. But it is still a little bit more like using a Band-Aid to help the symptoms along. Or when the season is over, sometimes people don't have symptoms anymore. So they are great intermittent drugs on and off. If you need it, you use it. If you don't, you don't have to use it.
I see.
But allergy shots are actually more of a long term, as close to a cure as we have in our allergy world of medicine.
Right. So now, between a male or a female and a child and an adult, is there one group likely to have more allergies than the others, or?
So anybody can have any type of allergy. We have a saying in allergy, you never say never, and always don't say always, because it's a little bit hard to predict. And once you've seen something in the body, so for example, a particular medicine, you can become allergic to that, or a particular food. But generally, the patterns are that little children, infants, toddlers, they have more food allergies. And they can tend to outgrow those food allergies, although that pattern is changing now too. They're holding on to their food allergies a little bit longer. We also see that seasonal allergies tend to get worse over time, and then they usually stop around age 5 or 6 when you've really come into your full allergy phenotype. But there are different waves of sensitization. So adolescents, adults, we're seeing adult onset asthma. So people can really become allergic to things at various times.
Got it. Now, in terms of the shots, you said that it can be a long term, like it can be for years or what?
Right.
So when do you decide that I'm done or I don't need it or I need to reduce, the dosage or anything like that?
That is a fantastic question. What the science says, or the textbooks tells us, is after about 3 to 5 years, your immune system makes a permanent change and you become more of a non-allergic type person. But it does take that full 3 to 5 years to actually change the immune system. And what they are, the allergy shots, are a small amount of the purified extract given to a person over time to slowly desensitize them to their particular allergies. But usually you get a sense from the person how they're feeling, how they're doing. Within about 6 months to a year, they notice a benefit. And the results are really remarkable. I remember seeing this in the lab during my fellowship, that you can see the change in even the blood system and what is released when you are exposed to that allergen. Instead of all of those bad inflammatory mediators, you really tend to have a more non-allergic profile over time.
Now, once you have stopped the shots, is there any chance that you may have to start them again at all? No?
Yes. So the textbook gives us 10 years. So they say exactly 10 years you will have relief from the allergies that you suffer, especially seasonal allergies if you go through the allergy shots. But in reality, what we see is that it's much longer. So a lot of times if someone went through allergy shots as an adolescent or young adult, that will last their lifetime. Sometimes when kids have allergy shots at really young ages, they may need to repeat them in the future. But really, their allergy shots are quite effective and they do last long term. And there is a small subset of patients that do continue allergy shots almost indefinitely.
Wow, that's quite interesting. Now, can you tell our viewers some basic things that can be done to minimize allergies and any message that you have for our viewers?
Sure. So one thing that we can do, since spring is on its way, or here, is just be careful around the tree pollen. So tree pollen tends to be sticky. It can get in our hair and our clothes. So when you come in from the outside, it's a good idea to change your clothes or take a shower and not take it into the bed with you, especially with small children. The other things we can do is keep our windows closed during the peak spring pollen season. And then there's another thing that we can do in terms of dust mite avoidance. Complete dust mite avoidance is really hard because we live with them. We live with dust mites everywhere. But one thing you can do is vacuum your carpets. That eliminates the dust mites. You can wash your sheets in hot water. That also kills the dust mites. They grow right back though, so this does require maintenance. Another thing you can do is use pillow protectors and mattress protectors for dust mites. So this helps to at least protect a person when they're sleeping from inhaling the dust mite particles that can cause such miserable symptoms. I guess the final takeaway message I should tell our viewers is that you don't have to suffer and be miserable with allergies. If you've been on medication that haven't worked for you, it might be worth a visit to another allergist to see if there are newer medicines that have fewer side effects that would work for you. Also, allergy shots are also possible. And the last thing, I guess, is food allergies, that there is hope on the horizon, and I think we'll have a cure in the next several years. Another thing is for drug allergies. For example, you can undergo a desensitization procedure and no longer have that problem with the medication.
Well, there you have it, folks. You got all the words of advice here, and then just do what you have to do, and you just enjoy the spring. Well, Dr. Mathuria, thank you very much for your time and sharing your expertise with our viewers. And now to all of you, please join me on my regular segment of Anoke Rang on first Sunday of every month. We'll see you then.